Columbia University's Jeffrey Shaman. Gentlemen, welcome to Meet the Press. Dr. Osterholm, let me start with you. Simple question. Are we ready to reopen the economy?
Well, first of all, let me just say that when we say what we mean by opening the economy, that's really unclear. We can't stay locked down for 18 months. But at the same time, when you have cases increasing, deaths increasing, healthcare workers without adequate protective equipment, and we're suddenly going back to what was once our normal lives, that's not a safe place to be. We can't do that and not expect to see a major increase in cases.
Jeffrey Shaman, have we squandered the 8 weeks in lockdown in that, or are we either rushing the reopening in that we don't have the testing and tracing program in place yet, or have we just squandered the 8 weeks?
We have not used the 8 weeks as well as we could have, unfortunately. It would have been benefited enormously from consistent messaging and a concerted, consolidated plan of attack for actually aggressively and proactively dealing with this virus. At this point, however, we do have to pick ourselves up where we are, and we need to start taking those measures. We need to look at some of the countries that have been very successful in quashing this virus down. In particular, I would point to Korea, South Korea, and Germany, and maybe even New Zealand and Taiwan. These are countries, in particular in the cases of Germany and South Korea, that had enormous outbreaks. They flattened them, they crushed them down, and they did this because they tested so aggressively, and they used contact tracing, and they were able to quarantine people who were becoming infectious before they actually spread to other people. It's a very powerful measure. It requires real investment, but we already have models that show that it can work. And once you've done that, then you're in this position of strength where reopening the economy is not going to lead necessarily to the rebound in cases that I'm expecting given this patchwork response we have right now and the reopenings taking place in some states.
Michael Osterholm, it seems as if the federal government is sitting waiting for a testing breakthrough before beginning, waiting to see if there could be a faster testing program before they commit to essentially a national testing program. You're going to hear a guest in a minute say that. We've heard Dr. Birx say this. I think we all want a tech breakthrough. What do you do before then?
Well, we have to understand that we're riding this tiger, we're not directing it. This virus is going to do what it's going to do. What we can do is only nibble at the edges, and I think it's not a good message to send to the public that we can control this virus in a meaningful way. And what I mean by that, even though, as Jeffrey just said, some countries have been able to suppress this somewhat, Korea has now got a major outbreak problem occurring. Germany has had an increase in cases. What we have to tell people honestly, what they want to hear, they don't want to sugarcoat it and they don't want to coat it in fear, but somewhere between now and tomorrow, next year, we're going to see 60 to 70% of Americans ultimately infected with this virus. What we have to do is figure out how not just to die with the virus, but also how to live with it. And we're not having that discussion. As Lewis Carroll once said, if you don't know where you're going, any road will get you there. And right now, that's where we're at. And we can't give people a false sense of security that we're going to do more than we can, but we also have to figure out how to live with this virus, and that's what we're not doing.
Jeffrey Shaman, one of the reasons why you heard it in our opening piece there are a lot of people that don't